Dr. Harrison has been practicing 10 years at Brant and Paris Family Eye Care, an independent practice in Southwest Ontario, and is part of the EyeRecommend network. The practice is a one of two office full-scope private practice. Dr. Harrison is a University of Waterloo School of Optometry grad and clinical supervisor for University of Waterloo and Illinois College of Optometry. He is a prolific contact lens lecturer with over 100 speaking credits in 5 different countries. He has spoken for Bausch & Lomb, EyeRecommend, and the Ontario Association of Optometrists. Dr. Harrison is married with 4 kids and loves to play and coach hockey. Dr. Harrison, you're up.
Wow, thank you very much. Can everybody hear me okay? I'll assume yes, because there's no response back. But thank you very much for having me. This seems like such a great lineup. Thanks to the speakers who came before. I really enjoyed listening to all 3 of you talk. I'm learning things, and this is fantastic for all those recent grads and soon to be grads. So thanks again, and thank you for that introduction. Prolific. I don't know if I would say that, but I appreciate all the accolades I can take. And as you said, I'm here to talk about independent optometry. So a little bit different perhaps than the 3 speakers who came before me. And similar to Dr. Langer who came before me, my life is work-life balance. That's the primary reason I'm in the current situation in terms of work and life. Dr. Langer has 3 little kids. I have 4 of my own, and he knows, and I know very intimately, and maybe some people in the crowd do as well. There's only a certain amount of hours in the day, and you have to prioritize and spend time with what you love. And definitely being that dad as well, and balancing, as was mentioned, I'm a big hockey guy, and I was coaching hockey at 5 o'clock tonight. And it's just nice to have that ability to balance all the different aspects. So the way I presented my talk was, instead of me just talking about myself and rambling about my career, nothing wrong with that, but I did a little survey. I have friends in pretty much every province in Canada who own their own offices. And I reached out to them and I said, what do you like? Why do you like owning your own office? Why have you possibly not, sold to an FYI, for example? Why are you not in a corporate setting? Why are you running the show? And this was the feedback that I got. So without a doubt, the number one answer was, no one tells me what to do, which, we all kind of like being in control. We all like being the driver of the own bus, as was mentioned. But that was the number one thing that everyone kind of gave back to me was, I like setting my own hours. I like having the staff that I want to hire. I like being responsible. At the end of the day, I know that, the buck stops with me, that old adage. They often reference things that maybe they'd worked in different offices before, or different practice models before, where there was different pressures. There was pressures to sell, there was pressures to hit certain targets. And not that there isn't that in private practice, not that there isn't that in my day-to-day life sometimes. Sometimes you feel like you're not having a great day because, maybe the dollars aren't there or something like that. But you don't necessarily have that corporate overlord saying, this is where we have to be at the end of the month, or where you're threatened, potentially your job's on the line. Those realities are in place for anybody. Setting my own hours, such a massive part of balancing the work and the life, the vacation, what amount of weeks of vacation I'm going to have, what I'm going to have to finagle to get time off for this or for that. One really good feedback I got from one of my friends out in Saskatchewan was, I really feel pride in building up my own local community. I'm a small business owner. We're part of, the Chamber of Commerce, and we're all in building the community together. And a similar thing was something that I don't really think about a lot, but it is so true, is, you're providing a great workplace and a work environment for the people. And, I know some of the interns that I've supervised are actually watching tonight, and you can think about some of the family, the work family as well. You're providing a great opportunity for them to grow in their lives and earn income for their families. And it's such an amazing thing that you maybe take for granted when you're giving people those opportunities and providing for that team and that community. So that was kind of the survey of independent, not being part of specifically being told, you got to do this, or you got to do that, you have to use this system, or you have to prescribe these contacts, but being able to really choose. And that led me, as a speaker, speaking on behalf of EyeRecommend, one of the big buying groups in Canada. what is the freedom? Well, the freedom is really the freedom of choice. And this was a quote that I pulled from someone from EyeRecommend that basically said, the biggest differentiator is choice, to selectively utilize the tools that you desire to provide the highest quality of care to your patients. And what that really means is, if you want to mold your practice in a specific way, you know, there's so many different types of practices now, even compared to 10 years ago when I started, VT clinics that specialize in disease, some clinics that are completely non-dispensing now. You really have that freedom that you can mold your office the way you want. And EyeRecommend, as a buying group, you can take or leave some of the features that they have. So for example, buying power, when you work together as a group, if you're buying lenses from different labs, if you said, I don't want to use this lab anymore, I want to use that lab, there isn't someone being like, well, this is the lab that we own, this is the lab that we have to use. You're not being told, you know, this specific contact, it's really not in your best interest to sell it because of this markup or this thing or that thing. So it really gives you that freedom when you're looking at buying power, what makes the most sense for your specific location, your office, and the population that you're serving. Another big thing with a buying group like EyeRecommend, some people might be scared, you know, if I start my own office. I had a few friends who started offices from day one. Some of them had support from family who were in the industry, some of them didn't. And being part of EyeRecommend, the collaboration is so key. So, you know, there's big advantages to different settings, and some of the advantages corporate settings, you know, there's different teams that can utilize different things, but EyeRecommend, they're really focused on success as well. One of the things I like what Mark said was, you know, everybody's in it together. And I think as a collective, optometry is a pretty small world, right? Like a lot of the docs right there, right now, you're going to see each other down the road. That's one of the things I really like about optometry is I can call up, you know, a friend or a classmate from BC or PEI, and, you know, it's kind of like no time has passed. But when you're part of EyeRecommend as well, that's such a big facet for everybody wants everybody to do well, which is awesome. One of the other really cool things about being part of EyeRecommend, in my office specifically, you know, we're 5-doctor office, implementing new tools and technology, you know, recently getting a topographer, you recently talking about, you know, IPL options and stuff like that. Just being able to implement and use it, you know, we don't have to ask anyone's permission if we think it's going to be successful in the office, or we have a passion for it, you know, even if it is a loss leader or something like that, where we say, you know what, we really got to serve our population, use these tools, we can implement them and use them. One of the biggest things about EyeRecommend as a buying group specifically, which I've learned, I did work at an office that was in OSI in the past, and not that OSI is bad, but the big thing I noticed is that EyeRecommend is massive on training. At our office specifically, we really try to get coaches in, we really try to get a lot of different trainers in to train up the staff so that, you know, we talked earlier, scribing and having staff that really free up your time. I work in a very busy office. It sounds like every speaker here does, but I'm also seeing sometimes upwards of 50 patients a day. And it would never be possible if we didn't have cross-trained, you know, CCOA, fully trained staff. And that's just all comes from EyeRecommend and their ability to push that. And the freedom aspect of it is, as opposed to, you know, some different models, there's no requirement either. So it's sometimes the choice to choose to do something. Sometimes it's the choice to choose not to do something. You know, versatility suited to what you want and what the office that you choose to work in or choose to start yourself goes to. And that's why I've been part of EyeRecommend. I've been very happy with it. And that's why I feel like our office has been very successful. So just speaking about some of the numbers there, you know, again, full scope independent optometry, owner of the practice, of course, being part of a large network across Canada, and really maintaining that autonomy and decision making. But also having those support structures in place that if you need help, if you said, you know what, I hate the accounting aspect of optometry, I hate HR aspects, you know, there are supports there. You don't like training, you don't like handling those specific things. There is ability to get support there. And just on behalf of EyeRecommend, they do have an associate signing bonus program. So this did not exist when I started, which would have been pretty sweet if it did. But for those, there's a lot of information. Just you can kind of read from there. We actually recently hired an associate who's actually going to get one of these signing bonuses, which is pretty great when he joins the office. Maybe he's even watching right now. Sorry, everybody else. And there's a QR code. So if you want to learn more, please pull out your phone if you want to take that, or if you want to reach out to me. I think some of the speakers we're going to post our emails after, but no problem chatting at any time. I'm not too far away from Waterloo. Brant County is not too far. So if you ever want to chat or meet up, by all means. And I'm going to also stick around for the question period. So if there's any questions at all, please, I'm happy to answer them. Thank you so much.